Hey, good afternoon, Nighthawks. This is Dr. H here, and I just want to go over chapters 13, 14, and 15 real quick. And it'll be a real brief lecture, if you will. Chapter 13, which of course takes place in your book on page 233. And if you stick to and all these lesson plans, if you stick to your book, you're going to be just fine as far as covering the material. The book really covers everything very thorough. Chapter 13 is over patient engagement and connected health. With healthcare shifting from provider-centered to a patient-centered model, with technology playing a crucial role in the transformation. Patient engagement refers to the active involvement of patients and families in their own healthcare. And while connected health encompasses the technologies that enable this involvement across care settings. And that is really an introduction to patient engagement and connected health. Now, some of the takeaways from this chapter, you should be able at the end of it define health literacy, e-health, and connected health. You should be able to explore various technology-based approaches to consumer health education. You should be able to assess the most common telehealth tools to engage patients at a distance. And you should be able to identify barriers, legal, ethical, and regulatory issues associated with technology-based connection and engagement strategies. Keep in mind the evolving patient role as you read through this chapter. Traditionally, patients were passive recipients of care. They had limited access to their own health information, a minimal involvement in decision making, very few tools for self management, and their dependence was on in-person visits. But that has changed with technology and today's level of information that's available to our patients. Today, patients increasingly expect 24/7 access to their information, convenient digital communication with their providers, and tools to manage their health between visits. Virtual care options when appropriate, telehealth, using their phones, their iPads, computers, laptops, all these items. Some of the factors that we find driving patient engagement are consumer technology expectations, policy initiatives promoting engagement, where we actually want the patients more involved, chronic disease management needs, and pandemic-driven digital health adoption. We saw during COVID-19 the the level of telehealth rose to levels that were unprecedented prior to that. Some of the core technologies for patient engagement, patient portals, secure messaging with providers, access to test results and visit summaries, appointment scheduling, bill payment functionality. You're able to reorder prescriptions without going in. Some of the mobile health applications that we see patients using, um, mobile apps are extended engagement beyond the desktop. Condition-specific management tools, medication reminders and tracking, symptom journals and trackers, which uh, it provides a wonderful connection between the patient and the provider. Health education resources, and we're going to talk a little more about health literacy here in a moment. Um, and then integration with wearable devices such as watches, rings, bracelets, things of this nature. Um, sorry, scroll down here real quick. Some of the remote monitoring technologies, the glucose meters, the blood pressure cuffs, wearable fitness and activity trackers, in-home sensors and monitoring systems, that's just a few. When it comes to telehealth, telehealth enables virtual care delivery from so many avenues that was not available to patients in the past. Uh, Video visit capabilities, store and forward consultations, um, remote patient monitoring and integration, and then virtual care team collaboration. They have access to their personal health records in a manner that they've never had before. And when it comes to health literacy, you'll find in the PowerPoints for this section, and I'm looking at it right now, it is PowerPoint number 7. The goal of health literacy for all widely embraced in many sectors of healthcare. It was a major goal of Healthy People 2010 and continued in Health Communication and Health Information Technology objective of Healthy People 2020. Health literacy is huge. The more that people understand about their health and healthcare in general, the healthier a population we can be, and the more efficiently we can deliver healthcare, and the ability to reduce health disparities grows. It's something that we're beginning to see is a patient engagement across care continuum. Excuse me. Preventive care and wellness, such as digital health risk assessments, preventive service reminders, wellness program platforms, lifestyle coaching applications are on the rise. And we're seeing this to the benefit of society as a whole. Um, Chronic disease management. We're seeing with technology chronic disease management in ways that we haven't seen before. We're able to look at condition-specific monitoring tools, medication management systems, system tracking and alerts, and peer support communities. You're able to reach across many boundaries and overcome many boundaries through modern technology to be part of a peer support program, as where before you may have had to have gotten into a car and gone to a scheduled event. We I see end of life care is more prominent with technology today, with advanced care planning platforms, system management, remote monitoring for palliative care, and then digital grief support resources, not only for the patient, but family members, friends, and that immediate circle of the patient. It's made this a much more efficient and simpler process than it ever was in the past. Uh, when we look at measuring patient engagement, there are several frameworks to help evaluate engagement technology effectiveness. Some of the engagement metrics that we look at are adoption rates and usage, message response times, sustained engagement over time, where we're not seeing burnout to the effects that we were in the past. Some of the clinical outcome measures we may look at are disease-specific clinical markers, hospital readmission reduction, which is huge. Um, the more that we, or the healthier we can get people as they leave the hospital, the less care is being given to that individual at the hospital, and the more engaged we can become with other patients. Overall healthcare utilization is a tremendous clinical outcome measure. Seeing exactly what healthcare is being utilized by the patient, what the benefit of it is, um, and going back to fewer readmissions to the hospital. We're also able to look at patient-reported outcomes, such as quality of life measures, system burden evaluations, treatment satisfaction, and patient activation measurements. Um, some of the implementation considerations that we're looking at may be accessibility and the digital divide and overcoming the digital divide, addressing technology access barriers. We see where now the internet is available to roughly 90% of the country. And the more that we can make that accessible, the more we can overcome that digital divide, regardless of economic status or location. Privacy and security, looking at securing sensitive health information, privacy controls for shared devices, compliance with regulatory requirements. These are some of the implementation considerations when we're taking technology into consideration. Integration with clinical workflows. Probably the number one thing from my point of view would be the seamless EHR integration, document of patient interactions, and team-based approaches to engagement. Um, Being able to pull visits, uh, documentation, medications from all avenues that a patient may have visited when concerning their health, reduces the number of mistakes and increases efficiency. Patient education is huge when it comes to technology. Uh, Clear enrollment processes, family and caregiver inclusion, and ongoing support resources to aid in furthering healthcare of the patients. Now, there are going to be some challenges and ethical considerations. I was looking to see where this may have been on your PowerPoint. Excuse me one moment. I'll come back to that in just a second. Some of the challenges and ethical considerations that have to be addressed is who owns the patient-generated data, third-party access and commercialization, long-term data stewardship. How long are we going to keep this information? Who's going to maintain this information? Who has access to it? Some of the relationship impacts that we may see are balancing digital and personal interactions, maintaining therapeutic relationships, managing digital communication expectations. What does the patient expect? What does the provider expect? Health literacy and empowerment. Like I said, this was on slide 7 of your PowerPoint for chapter 13. Some of the health literacy and empowerment that we look at is communicating complex information effectively, avoiding information overload. We don't want to give someone so much information that they're not seeing any information. Respecting diverse preferences, and balancing autonomy with guidance. We want to make sure that we are guiding our patients and the providers both down the right avenues and giving them that autonomy to be a major player in their own healthcare. The health professional's role, supporting patient activation, assessing readiness for engagement, setting incremental engagement goals, building digital health literacy, helping the patients become, and not just the patients, but the healthcare workers, um, more confident in their use of digital health. Um, so just some of the things for chapter 13 to keep in mind. Patient engagement and connected health technologies are fundamentally transforming healthcare from a provider-centered model to a collaborative partnership. And these tools are extended care beyond traditional settings, and they're empowering patients with information and capabilities, and they're creating opportunities for more personalized and continuous care relationships. Moving on to chapter 14. In chapter 14, we're looking at using informatics to promote community and population health. Um, and with this, some of the objectives that you should know or learn once you've completed chapter 14's reading. And let me see, chapter 14 picks up on page 259 of your text. And then you've got a few slides, not quite as many in chapter 14 as you did for 13 on your PowerPoints. Between these two, you're going to cover all the learning and course objectives necessary for chapters 13, 14, and 15. The introduction to population and community health, while clinical informatics focuses on individual patient care, population health informatics expands the scope to improve health outcomes for entire groups of people. Community health informatics specifically addresses how technology can support health improvement within a defined geographic or demographic community. And like I said, some of the things that you should learn, or coming back to it, is you should be able to provide an overview of community and population health informatics, describe informatic tools for promoting community and population health, and you should be able to define the roles of federal, state, and local public health agencies in the development of public health informatics. Now, when we talk about this, we look at the population health framework, and population health encompasses health outcomes distribution within a population, patterns of health determinant, interventions that affect these determinants, and policies influencing interventions. And these are some of the things that you will learn and want to know moving forward out of chapter 14. Some social determinants of health. Approximately 80% of health outcomes are determined by factors outside clinical care, and that's a huge number. Things such as economic stability, and that includes employment, income, and patient expenses. Education, which goes back to health literacy, language, and early childhood education. We are finding that the younger we can introduce health literacy, the healthier a population is. Social context, when we look at social integration, support systems, discrimination of health care, the physical environment itself, that's going to be housing, transportation, safety, sidewalks, resources available to patients, things of this nature. Healthcare access, coverages, providers, and health literacy. Um, when we look at population health, a big thing that we do look at is health equity and disparities. Health disparities being the differences in health status between groups. We also look at health inequities or the disparities that are symptomatic, avoidable, and unjust. And then vulnerable populations, group at a higher risk for poor health outcomes. And these are some items that we're going to study and we're going to go over, and not just in this course, but in upcoming courses. Health equity and disparities. It is the position of all healthcare workers to do what we can to reduce health disparities, to eliminate health inequities, and to aid and assist these vulnerable populations. Some of the things you'll look at when we're going through chapter 14, and I was going to see if I could find this in your notes real quick. Or we'll look at clinical data sources such as electronic health records, health information exchanges, claims billing data, pharmacy and prescription data, and laboratory information systems. These are the core data sources that when we do analytics and we look at the data and we look at trends, this is going to be the core five, if you will, where we're going to pull these from. We'll also will look at community generated data. We'll look at community health assessments, social service utilization, school health records, community surveys and feedback, and geographic information systems. Where a community lives can tell us a lot about the health inequities, health disparities, social economic status, and we can look and find why is this certain group not receiving the level of health care that's deserved or required to maintain a level of a healthy society within that. And this is where we'll pull that information. Some of the key population health informatic tools that we'll look at, population health analytic platforms such as risk stratification and predictive modeling, hotspot identification and geographic analysis, disparity detection and analysis. We'll look at risk assessments within the health community, and that is going to be on slide 8 of your PowerPoint for chapter 14. And some of the items we'll look at is hazard identification. We'll determine the types of health problems that could be caused by exposure to a potentially hazardous material. We'll look at exposure assessment and determine the length, amount, and pattern of exposure to the potentially hazardous material. Dose response, which is an estimate of how much exposure to the potential hazard would cause varying degrees of health effects. And then we also will look at risk characterization. As health administration and informatics or as health data analysts, we need to be able to conduct assessment of risk of the hazardous materials causing illnesses in population and determine how much risk is acceptable. Some of the examples that you'll see of risk assessment tools are going to be provided from Suicide Prevention Community or the Suicide Prevention Community Assessment Tool, Youth Risk Behavior Surveillance Systems, the Behavioral Risk Factor Surveillance Systems, and the National Health and Nutrition Exam Survey. And you'll find this on number 9, slide 9. You'll also find when we talk about some of the items that informatics aids in healthcare is if you go to slide 17, you'll see how EHRs promote public health, generate population level alerts to be sent to clinicians through these electronic record and data exchanges. And that's the benefits of EHR. Let's see. A big thing that we need to look at, I'm trying to keep in mind and keep your time short and still cover as much as I can. Um, some of the things we look at is disaster preparedness and response. Informatics plays a critical role in emerging scenarios. When we look at preparedness systems, we look at vulnerable population registries, resource capacity tracking, such as how many beds, what equipment, and what personnel do we have in a given region for a population, emergency communication platforms, training and simulation systems, and evacuation planning tools in case of emergency. Some of the response technologies that are involved in informatics is real-time situational awareness dashboards, mobile data collection and reporting, patient tracking across evacuation and care sites, and then volunteer and resource management. There are always ethical and legal considerations in all situations. We want to make sure that we are taking into account privacy and consent of the patient. We want to make sure that there is not a bias or a lack of equity, health equity. By doing ways we can do this is by addressing algorithmic biases and risk prediction, ensuring technology benefits for vulnerable populations, overcoming digital divide and technology access concerns, cultural appropriateness of interventions, and representative data collections across multiple populations. Some of the future directions that we can take into account, and when it comes to population health informatics, is precision public health, such as genomic data integration with environmental factors, targeted information based on population subgroups, and that goes back to where we were talking about certain populations maybe not having access, looking at zip codes and looking at the health inequities, the health disparities, the socioeconomic status, and how we can overcome these items. Of course, a hot topic right now is the application of artificial intelligence or AI. Machine learning for complex pattern recognition is going to be tremendous in the future of healthcare. Computer vision for environmental assessment, and predictive analysis for community health risks. Um, so that kind of brings into the health professional's role. And there's several ways we can look at this. As health professionals, you can contribute to population health informatics in various ways. On the individual practice level, we can look at documenting social determinants systematically, providing feedback on system usability, and advocating for tools that address community needs. On a more organizational level, we can look at participating in data governance committees, supporting cross-sector partnerships, and helping to evaluate the technology impact. Is it having a positive or negative impact across the organization? On a more community level, engaging communities in advisory boards and getting the community involved, educating about technology, the benefits and limitations to the community, advocating for community data access, making sure we're overcoming that digital divide, supporting digital literacy initiatives. And this is getting out and educating the community on the various types of technology available to them. And then more importantly, building trust between systems and communities. It's great to have this amazing system, but if no one's using it, because trust hasn't been built, then it's really not doing anyone good. And that's really it for chapter 14. So we're going to move on to chapter 15 just real quick. And chapter 15 is kind of a long chapter, so I'm going to go through semi quick. Um, with chapter 15, there's a few adjectives that you will come away with. You should be able to describe health professional education in relation to the foundation of the knowledge model, excuse me. Explore knowledge acquisition and sharing, and assess technology tools and deliver modalities used in healthcare professional education and continuing education. Now, some of the modern instructional technologies are going to provide opportunities for simulation, complex multimedia, virtual reality assistant clinical scenarios. And here at UNG, our nursing program, and if you ever want to come on campus, we can see if we can get you a tour of this. They have an amazing virtual reality emergency room. and delivery room. And this is enabling us to train more people, more individuals in a safer environment for both the patient and the first responders. Information and literature gathering internet tools is also tremendous. We're finding more and more social media use in education. This enables us to, or it helps students put concepts into context, maintain currency in the course content, and promote the development of skills that will help support professional collaboration as students enter the practice arena. Um, we're also seeing a higher interactivity in web enhanced courses, learner to learner, which is where students interact to troubleshoot, work out challenges, and exchange solutions. Learner to instructor. Then this is direct interaction with the instructor, such as we have in our online courses, and learner to interface interactions, and this is access to content itself. There's also a learner content in which students interact with course content, and we'll get more into that later on in the semester. Some other items that we want to cover and make sure you have an understanding of in Chapter 15 are learning spaces. Learning is a multispatial function, and in the age of technology innovation, instructional delivery can inhabit many forms in both physical and virtual spaces. Spaces in academia are no longer defined by a class or its content, but instead by the learning the class is trying to promote. And so, and for me, it's more of what you're learning and able to apply in real world situations rather than just going into a classroom and putting a check in a box. Some of the next generation digital learning in the environment or NGDLE that we'll see, it will include interoperability and integration, personalization, analytics, collaboration, and accessibility and universal design. Um, let's see. We're seeing more and more web-based courses. Asynchronous and time-independent elements of web-based courses provide flexible class times, meet needs of the population of non-traditional learners, which a lot of us in this program are. I was a non-traditional learner. And so, the difference between traditional and non-traditional is traditional has the opportunity of going from high school to college, either living on a college campus or living nearby, attending courses for that 4 years, graduating. Non-traditional typically is going to be someone who is working full time while taking courses, while raising a family, maybe didn't go straight from high school to college. And so the web-based courses that are asynchronous, such as this program, uh, really open the door to a lot of learners, not just traditional, but non-traditional as well. Web-based courses we're able to re-envision classroom interaction, and depending on the specific delivery mode, it can even change basic pedagogical concepts, the way we teach, how we teach, what we teach. We're seeing a lot of hybrid and blended deliveries, traditional courses where we're in a classroom, but then also instead of meeting twice a week, may have some online activities along with some in class, or we may have scheduled classrooms via online. Smart classrooms is an area that's growing. Digital and multimedia classrooms are going to be classrooms that integrate computer and audio visual technologies by providing ceiling-mounted projector with access point at the front of a room, an instructor, a podium workstation, more of a classic classroom. An enhanced smart classroom also will provide network student workstations instead of traditional desks, allowing students to follow along and perform network or web searches, chat, blogs, etc. And then in a virtual environment, such as online courses, we're seeing more and more of this as well in the considered to be a smart classroom. The next generation or millennials, and in the generation coming in after the millennials, by far the smartest generations we've seen globally. These students have grown up with instant access to online and everything, including information, data. They're connected digitally, experientially, and socially. Interacting in a peer-to-peer situation is familiar and a common learning mode with this generation. They seem to be skilled multitaskers and desire information immediately, which is fantastic. And so, our job now is to find an avenue for you to take this information and provide it into a real world, a learning and a purposeful situation. Moving on to, let's see, let's talk about some of the internet tools. From chapter 15, the general consensus in education suggests that any technology that allows users to interact and engage both materials and each other is useful. Anything that we can do, whether we're students, care providers, patients, that allows that interaction is going to benefit everyone involved. One of the most common and proliferate search tools in technology today is Wiki. Wikis are websites or hypertext document collections that allow users to edit and content in an open-ended format. We have to be careful with wikis because anytime that we see something that's a Wikipedia or a wiki style website, we do have to fact check because they are not necessarily fact checked before being put on. Um, Electronic discussion groups that use email to communicate, instant messaging, discussion boards. This allows collaboration with multiple individuals within a particular field of study. Um, Research suggests that seeing, hearing, doing, and interacting afforded by multimedia facilitates learning retention. The more we interact, the more we do, the more we retain this information, and the more we know what to do with the information once we have it, which is equally important. Having the information is not enough. Knowing what to do with it is that next step. Um, Webinars and webcasts, let's just touch on that real quick. Webinars, a web-based seminar that's used for conferencing software, allows educators to share their computer screen and files and interact with their students. We do this when we hold our Zoom meetings or we hold some live lectures. Sometimes webinars are shared from companies like Microsoft and Google. They are outstanding, and I would highly recommend in the field that you choose to go into, taking advantage of some of these webinars. Let's talk about fair use of information real quick. Fair use refers to a legal concept that permits the use of copyrighted works for specific purposes without obtaining permission from an author without paying for the use of work. Fair use has expanded from print materials to applying to copying and redistribution of digital media, graphics, music videos, audio, software, or computer programs. So we have to be careful uh, in whose information we use, whose music we use, and make sure that we are giving credit to anyone that we do use when we do use this information. Some of the criteria for determining fair use, and you'll find these on slides 41 and 42 of your PowerPoint. Section 107 of the U.S. copyright law is where this is housed. The purpose and character of the use, including whether such use is of commercial nature or is for nonprofit educational purposes. Typically, nonprofit educational purposes, there's never an issue. But if you are doing something in which you are going to earn income or revenue off of it, there could be an issue there. The nature of the copyrighted work is the criteria is there in section 107. Um, the amount and sustainability of the portion used in relation to the copyrighted work as a whole is also set within section 107. Let's take a look here. And that's really it for chapter 15. With that being said, there's a lot of material to cover in this particular module between 13, 14, and 15. These are very important chapters moving forward into your upcoming courses. So make sure that you do the readings in your book. Make sure that you go through these PowerPoints. I meant to tell you, chapter 15 is page 280, or excuse me, 279. And so make sure that you go through these and read these. If you have any questions, reach out to the professor, whether it's me or anyone else. And keep in mind, here's my PSA, right? All quizzes and exams are due at noon. If you have any questions, email me. I will help you no matter what. anytime, day or night. And I want nothing but the best for you. So, with that being said, Nighthawks, thank you for listening to me ramble on for the last however many minutes. Hopefully, you got something from this. And if not, reach out and we can go through this together. Have a wonderful Nighthawk Nation day. Goodbye, everyone.